From the consultation, community engagement, outreach, 300 Voices project has been on an epic journey. African Caribbean men have powerful stories to tell around their thoughts and opinions around mental health services. 300 Voices was established as part of Time to Change, England's biggest program for raising awareness of mental health issues and changing and challenging stigma and discrimination that people who have mental health problems commonly experience in their daily lives. The engagement process, bringing together service users, statutory partners, community organisations, voluntary agencies, the general public to bring this issue to light and raise awareness, raise dialogue and gather stories. 300 Voices is designed around a method of engaging service users with direct experience of inpatient provision and staff from mental health services. The police and other agencies in facilitating workshop space in a local area where they can work together to tell their experiences of engaging with the mental health system, opening new opportunities to develop mutual understanding and empathy to plan for the future. This process of engagement aims to encourage open and honest dialogue that looks at when the system works at its best and how this can be maintained with service users at the heart of any service improvement. A core feature of the 300 Voices approach is recruiting and training local co-facilitators that include both service users and professionals to deliver the workshop program. These workshops are complemented by a toolkit describing the 300 Voices approach and materials to develop a program in a way that is relevant and responsive to local circumstances and needs. The reason why the 300 Voices project is important is that people from Black, minority ethnic backgrounds who have mental health problems are known to be detained under the Mental Health Act more than twice as much as any other group. They are also more likely to be diagnosed with a serious mental illness such as schizophrenia than their white counterpart and prescribed a higher dose of medication, and unfortunately they also have much poorer access to psychological therapies which often lack cultural sensitivity. This compelling evidence is a backdrop for why the 300 Voices project is working with young African and Caribbean males to develop their confidence to speak openly about their mental health and encourage statutory staff to share good practice and improve outcomes for these service users. The staff stories have been important in this process. For the mutual understanding between staff and service users, this has become more than just a project. It's become a social movement. From the partnerships with service users, staff, the Birmingham and Solihull Mental Health Foundation Trust, Time to Change, Birmingham City Council, councillors, West Midlands Police, Mind, Redeeming Productions and more, the understanding has started. True co-production is happening to help create a legacy of better experiences for African and Caribbean men and staff within mental health services. This is just the beginning. This is the 300 Voices journey so far.